Welcome back to Ironwood Cancer Insights, and I'm your host Kayla with Ironwood Cancer and Research Centers, and today I'm joined with a special guest, Dr. Okolo-Taku, which is a skin cancer specialist here at Ironwood Cancer and Research Centers. This May marks the beginning of Skin Cancer Awareness Month, which is a pivotal time to raise awareness for this type of disease. Raising awareness about skin cancer is key because early detection can really help save lives. Dr. Okolo, thank you for joining us.
Thank you, Kayla.
Yeah, can you start with telling some of our viewers why Skin Cancer Awareness Month in May is so important and what they should know?
So Skin Cancer Awareness Month is very important for a number of reasons. With any other cancer awareness program, these are meant to educate the public by saying, okay, this month we're focusing on XYZ. It raises awareness. When someone is aware of something they should be focusing on, it increases the drive for them to go and talk with their physicians, go for recommended examinations, screenings, and things like that.
Awesome. So with May being Skin Cancer Awareness Month, can you just talk a little bit about what skin cancer is and maybe a few of the types of skin cancer?
Of course. So skin cancer obviously is a cancer of the skin. Like cancers for any other part of the body, it is a change of the cell type from normal to abnormal, which leads to then a continuous and unproductive growth of an abnormal cell type. There are multiple types of skin cancers. There are three main skin cancers, though, that we tend to talk mostly about. The others are a little bit more rare, but the three main ones for people to keep in mind are melanoma, squamous cell cancer, and basal cell cancer.
And then, does skin cancer affect a certain amount of people or a certain type of person?
Anybody who has skin. And I tell that to all of my patients. There's a misconception that certain groups of people are more prone to skin cancers, whereas certain groups of people have absolutely no risk associated with skin cancer. But I tell it to everybody, if you have skin, you are at risk of skin cancer.
So in talking about skin cancer, are there things that are potential causes or higher risks for people that they should be aware of?
Definitely. So when it comes to skin cancer, skin damage is probably the primary cause of skin cancer. By skin damage, we mean things like sunburn and even excessive tanning. When you think about the fact that tanning your skin or burning the skin essentially is destroying that top layer of your skin, it does lead to a transformation of the cell type, and several years down the line can increase a person's risk of developing different types of skin cancer. We've actually seen that early sunburns, so burns in the youth that are extensive, actually have shown that people as they get older present with more risks of different types of skin cancers.
So it sounds like sunscreen could be a main key in fighting off that potential.
Yeah, skin cancer. Sunscreen is key. I tell everybody to use sunscreen. You don't always need to use like the big, thick, goopy stuff. If you are just doing your day-to-day activities, wearing sun protective clothing, if the only exposed areas are your face and your arms, then use sunscreen in those areas. There are different types of, moisturizers now available that you can wear every day without feeling like you are, about to go onto the beach and looking like a snow cone or something like that. So daily sunscreen, I think, is at least a minimum.
Awesome. And then is there an amount of SPF that people should be using? Does it matter on like SPF 50 versus SPF 20?
I usually tell people at least 30. Once you get to high enough SPF, I think it all becomes the same. Typically, I say 50 or greater, you're probably getting the same amount of coverage. What changes at that time then is frequency of application. For example, if you're going to the beach or to the pool, you want to make sure that you are reapplying frequently when you come out and are going to be laying out in the sun. That's probably more important than just wearing one-time SPF of 70, because by the time you go in and out of the water, it's losing its efficacy.
So when people are on the lookout for skin cancer, are there early signs and symptoms that they should be watching for?
Typically, there are no symptoms associated with early skin cancer, as it tends not to be painful. But there are signs that we want people to be looking out for all the time. We call it the ABCDEs of cancer. Easy to remember, first 5 letters of the alphabet. A for asymmetry, meaning if you see an abnormal discoloration on the skin, if it no longer looks round, uniform like a mole or anything like that, That should cause you to be alerted to it, start watching it, monitoring it. B is borders. If the borders of the lesion become more jagged, less clean, that's also concerning. C is the color. If within the skin finding the abnormality, you're seeing kind of a mosaic of different colors, that's concerning. D is diameter. Typically anything greater than 1/4 of an inch is definitely concerning. And then E is evolving. What that means is if you started off having a completely normal looking mole, and then for whatever reason it starts to change in any of the other ways we've mentioned, size, shape, color, that's also something that's concerning and is an immediate, consult to go see your dermatologist.
Okay. So say somebody does get, diagnosed with skin cancer and they're seen by their dermatologist. What happens? What are those next steps and what does treatment look like?
It's very different based on how significant the cancer is. One of the great things about working in the skin cancer field is that it's very multidisciplinary. So I get to work with great dermatologists, I work with radiation oncologists, and I work with surgeons as well. And depending on how significant the cancer is, a patient might only see their dermatologist, or they may end up seeing the rest of the care team as well.
Okay. So after they're diagnosed, what kind of tests are involved in that diagnostic type of treatment?
So when someone is initially diagnosed, it's probably following a biopsy of an abnormal looking lesion on the skin. Depending on what the diagnosis comes back as, whether it's a melanoma, squamous cell, or basal cell, they may end up having what we call a wide local excision. That's a removal of the entire cancer, making sure that the margins are negative. What that means is that when the dermatologist or the Mohs surgeon is removing the cancer, they're making sure that they take out not just the area of the cancer, but a good amount outside of the circumference of the cancer to make sure that they're removing everything. Sometimes, depending on the type of cancer, radiation might be involved as well to, again, ensure that all abnormal cells are taken care of. Sometimes it goes further, especially in, for example, the melanoma field. If we are concerned that the cancer may have spread, there would likely be evaluation by a surgeon and a potential for something called a sentinel lymph node biopsy. That means evaluating the closest lymph node to that area of the skin cancer to check if it's involved. So that has already taken you from the dermatologist, a surgeon, and then potentially radiation could be used. And then you enter the realm of systemic therapy, which is where you then meet your medical oncologist like myself. In this situation, we are either working in an adjuvant setting, meaning post-operatively, there have been some developments, potentially lymph node involvement, where we want to start some treatment to reduce the risk of the cancer spreading or coming back. Alternatively, sometimes systemic therapy is needed, for example, in basal cell cancer or squamous cell cancer, if the amount of cancer is so extensive or the person has had just so many cancer removal surgeries that at that point it's been all too much for them. And so we then can utilize things like immunotherapy and targeted therapy as well, which have come a long way for the treatment of cancers. Rarely at this point are we using traditional chemotherapies to treat skin cancers.
Oh wow, it sounds like it's really great for patients.
It really is. It's very well tolerated.
So we know that there are some commonly asked questions around skin cancer, and one of them being, is skin cancer painful?
Initially, skin cancer is not painful. It typically starts off as just a discoloration on the skin, and at that point, most people either notice it, go see their dermatologist, but if not, if it begins to develop, get larger, it can become painful at that point.
So another question, can people with darker skin get skin cancer as well?
Definitely. So skin cancer, like I mentioned, affects anybody who has skin, and having darker skin although can protect you from frequency of getting sunburns, does not mean that you are out of the realm when it comes to developing skin cancers. In fact, because there is this misconception around darker skin and skin cancer, we have found that people with darker skin who develop skin cancer actually end up having a poorer prognosis overall, because their disease tends to be picked up later once the disease has spread much further along.
So it sounds like early detection is kind of key for those individuals.
Exactly.
So also when talking about skin cancer and the sun, people in tanning beds, if you're only using a tanning bed and you're not out in the sun, can you still get skin cancer that way as well?
Definitely. The skin tans because of the exposure from UV light. And whether or not you're getting that outside from the sun directly or in a tanning bed, you're still having your skin get exposure to that ultraviolet light, which ends up transforming the skin cells. So whether or not you're getting it from the sun or a tanning bed, it still puts you at risk for skin cancer.
And then another frequently asked question is there supportive care or lifestyle changes that you can make after getting a skin cancer diagnosis that can help?
Yeah, so a lot of things that happen with skin cancer, unfortunately, tend to occur from changes earlier in life or years before, primarily sun exposure and frequent sunburns. But there are certain things that we found that might improve your risk of developing frequent sunburns. We do know that individuals with a decreased immune system are at higher risk for developing certain skin cancers. So I always tell people, bolster your immunity, making sure that you're eating well, staying well hydrated can go a long way. I encourage people to consume an anti-inflammatory diet, looking mostly at things like the Mediterranean style diet, primary oils being things like olive oil, making sure that your food, your plate is nice, bright, colorful, stay away from beige foods, things like that, because you're increasing the antioxidants that you're also consuming, increasing the amount of vitamins that you're eating, and that's essentially what you want. That's what your immune system needs. So I always, harp on improving your immune system could down the road decrease the frequency at which you develop skin cancer. The other thing is just protecting yourself, whether it's physical barriers like the clothing you wear or use of sunscreens. You want, just because, you use sunscreen once in a while, if you get a burn in between, that risk comes right back, so you want to make sure that you're protecting yourself. So from the foods that you eat on the inside to the protective barriers that you wear on the outside.
So it sounds like lifestyle changes can really help a lot of people. That's really good to know. So I know we talked a lot about sun exposure and being exposed to the sun and that being a potential risk for getting skin cancer. Can people who are not exposed to the sun or parts of your body, that are always covered from sun exposure, can you still get cancer in those areas as well?
Unfortunately, yes. So we have different types of melanomas that can develop in areas that you wouldn't actually think of. That cancer can develop in the nail bed. It can develop on the thick part of the skin, so the palms and the soles of the feet. And we can also develop melanoma in the mucosal system. So this can be inside the mouth, the GI tract, things like that. So just because somebody doesn't spend time in the sun doesn't mean that inherently they have zero risk for skin cancer, unfortunately.
So Dr. Okolo, I know you mentioned for treatment there's been a lot of advancements lately. Can we kind of talk about what treatment looks like for patients?
Of course. We'll use squamous cell skin cancer as an example. So for somebody who has a very advanced squamous cell cancer, who has initially had a biopsy done by their dermatologist and who unfortunately may have lymph node involvement, we can eventually end up using something like immunotherapy to treat. Immunotherapy is an IV treatment given through the vein, and it's given anytime from every 3 weeks to every 6 weeks. It tends to be more tolerated, better tolerated for patients than traditional chemotherapies, and we don't tend to see the typical side effects that one would expect from chemotherapy, example, hair loss and things like that. It does have its own side effect panel, which can include autoimmune type conditions like thyroid dysfunction, but for the most part, it's very well tolerated, and we tend to treat people for as long as they're able to tolerate it, up to 2 years. We are seeing patients having complete responses to these types of medications. In the world of melanoma, we are also using immunotherapy as well. And we are on the verge of using TIL therapy as well. TIL is tumor infiltrating lymphocyte, and what that means is we would get a sample of the tumor itself and test it, send it for additional testing, and get a specific treatment tailored to that patient's particular melanoma, which we would then use to treat them as well. This is new, it's up and coming, it's not quite ready for prime time, as we say yet, but it's definitely something that we're excited about upcoming for the treatment of widely metastatic melanoma. In the world of basal cell cancers, we use what we call hedgehog inhibitors. These are oral drugs that one can take at home to treat advanced basal cell cancers as well. So we've moved away from the traditional chemotherapies, although offered when needed. We're very much so in the world of immunotherapy, targeted agents, and things like that for the treatment of skin cancers.
Oh wow, that's amazing. It sounds like treatment has really come a long way and patients have a lot of options.
They do.
Thank you for joining us, Dr. Okolo.
Thank you for having me.
Yeah, so May is Skin Cancer Awareness Month, and it is the most common type of cancer. So if you have any concerns, make sure you're seeing your primary care doctor. And if you have any more concerns, Dr. Okolo is also here at our Gilbert and our Chandler office, and you can find more information about her and about Ironwood at ironwoodcrc.com.